Hello there. This is Jen Hurley. I'm from the membership committee, the chair of the membership committee, and we've gotten a lot of questions lately about Medicare, so I thought I'd hop on and perhaps just have a little chat with you to give you some information. This is not a fully comprehensive presentation on how to opt into Medicare, but hopefully it'll give you a head start. So just a few notes to begin with. I just wanted to let you know, if you haven't already, that after many years, LMHCs have been included as providers for Medicare, which is a very exciting, very big deal. This went into effect in January 2024, and we've been fighting for this for a very long time, so we should be celebrating that. A couple notes here. Medicare language refers to us as MHCs, mental health counselors. As you probably know, we're called different things in different states. So across the board, they're just referring to us as mental health counselors. So when you look at your contracts, when you look at all of the different materials that the CMS has provided to you, that is what you're going to be looking for. And if you are looking to be a fee-for-service provider for Medicare, which is why you're watching the video, you would fall under a Part B provider. This is a federal program, so they have a very clear definition of what MHCs are. Just to let you know, our state license does have requirements that cover all of the requirements that the CMS states. However, if you are licensed in another state, or if you're planning on moving to another state, then make sure that you're reviewing all the requirements of the state license that you're moving to make sure that it still covers all of the Medicare requirements. All right, so now what? So now you're going to decide whether or not you'd like to become enrolled as a Medicare provider, such as opting in, or if you'd like to opt out. If you would like to opt out, as in you do not want to enroll as a provider for Medicare, you will fill out the Medicare opt-out affidavit and submit it to the corresponding Medicare Administrative Contractors, or MACs, for our state. More about that later. And we have another little webinar that talks a little bit more about that. But for the purposes of the rest of this particular presentation, we're going to be talking about how to opt in or how to enroll with Medicare as a fee-for-service provider. So just as a heads up, this is the basics. There are many manuals with many pages that you can read with more details, and more information can be found at this website here, www.cms.gov, Medicare Enrollment Renewal of Providers and Suppliers. They also have a very handy step-by-step instruction with videos, which is very helpful. There are some updates here. This kind of covers a big question that we get many times. The manual provides information about services, both for telehealth and in person, and it defines what those things are and indicates what we can provide as enrolled providers. They also publish bulletins when bills are passed that provide more specific or changed requirements. So there was in there in one of the bills previously passed that required beneficiaries, or those that are the consumers of Medicare, that if they receive telehealth services, they need to have one in-person visit within 6 months of the start of the telehealth service. As of March 20th of this year, 2025, this requirement has been postponed until September 2025. There have been updates along the way that have been pushing out that requirement here and there, so you may have heard it, other people talk about it, or concerns about when this is starting. And in fact, we also had this in the newsletter most recently in the spring. So if you are concerned about that, make sure that you're staying up to date with the bulletins. If you're telehealth only, for example, or if you provide services to people with telehealth only, make sure that you're keeping up to date on those requirements that, again, have been pushed until September 2025. So make sure that you're vigilant about that. What are the steps? There's three main steps identified by the CMS that you need to get started as a provider. Step one is that you need an NPI number. That's a National Provider Identifier number. And these identify you as a provider, not just us as behavioral health providers, but actually there's NPI numbers for medical or other types of providers as well. There's a national database that contains all of our NPI numbers, and you can register with this website here, nppes.cms.hhs.gov. And just as a heads up, you probably already have an NPI number, and perhaps you already know what it is. But even if you know what it is, even if you're not practicing independently, you may want to check your NPI number. As I tell my people in private practice world, those addresses that are assigned to you when your NPI gets assigned don't necessarily change unless you go in and change it yourself. So if you do not have an NPI number, The first step is to go get an NPI number, and you can register here at that website. And your second step is if you haven't checked out your NPI number in a few years, perhaps go in and make sure that the address and all the information is up to date. And this is true regardless of your choice to enroll in Medicare. It's always good practice to make sure your NPI number is up to date. But that is the first step of enrolling in Medicare. Let's see, there's two types of NPI numbers. As an individual provider, you will have that NPI type 1 number. That's the one that you're assigned initially, usually. And that is the number that I was referring to in the previous slide. However, there is another type of NPI number, which is a type 2 provider number. And this refers to an organization or an agency or some similar entity. And if you have a group practice or an LLC or above in a tax entity, then you will additionally need a type 2 provider number. If you've been in private practice for a while and you've been enrolling with third-party billers for a while, this will not be new to you. But if you are just starting out, make sure that you know the difference between the NPI type 1 number and the NPI type 2 number. As an individual provider and a sole proprietor, you'll probably only be using NPI type 1, but any other type of business structure, you'll be using an NPI type 2. So regardless of whether you have one type of number or both, make sure that those are clearly identified for you before getting started in the enrollment process. Step 2 is to complete PICOS. What is PICOS? Provider Enrollment Chain and Ownership System is what that stands for. And that's what the Center for Medicare and Medicaid Services uses as their online web-based platform for credentialing. I have the link for you here, and these slides will be available for you as well. For those of you that have been in practice for a while and are enrolled with other third-party billers, you may be familiar with the CAQH system. The CMS does not use the CAQH system. They have this system instead. Although I believe that you can use some of the information from the CAQH to go into PICOS and add that there. However, they are independent of each other, and the CMS uses this PICOS as their particular platform. So if you've already done the CAQH, great, but you still need to go in and do PICOS independently. You will have to sign up for an account, log in, and then when you're ready to enroll, you'll select new application to begin the process of enrollment, either as an individual or a group practice. The application process is all online, and you can track the status of your application in real time. So you can update it as applicable, and you can check and see where the application status is at. It is a requirement for Medicare providers that you use electronic funds transfer or EFT. So you'll need to set this up by filling out the CMS 588 form, which is part of the enrollment application. But be prepared that that is a requirement as the CMS does not distribute paper checks. If you are a visual learner, again, I will strongly recommend the YouTube tutorial that they have on their website, which is called the Initial Enrollment Tutorial, which you can find here. Step 3 is to know your MAC. So the MAC is a Medicare Administrative Contractor, and there are multiple ones that cover different regions in the United States. These are different depending on which state that you're practicing in, and these entities are responsible for your enrollment and will be the point of contact for both you for this enrollment process and any other questions that you have moving forward with your relationship with Medicare. So be aware what that is, and be aware who it is. If you're practicing in multiple locations, it may be that you have multiple MACs. So if you're licensed in more than one state, make sure that you're checking the entire list that I have here at the bottom of this slide for more than just the Massachusetts MAC. For those of you that are only contracting in Massachusetts, the Part B contractor is the National Government Services Incorporated, and their information is listed on this slide. So moving forward, what would you like to know or what should you know? Make sure to read your contract with Medicare very carefully to ensure that you're in compliance with your agreement, just like any other third-party payer. If you've taken my class, you know that I say this ad nauseum. Make sure to read your contracts. There may be stuff in there that you wouldn't otherwise know. We do have an obligation to follow our regulatory requirements, as you know, in 262 CMR sections 2 through 8 for practice. And you should know that some of your contracts, even beyond Medicare, may have other obligations that you're responsible for. Examples that I give in my class are things such as maintaining treatment records for longer than the required 7 years. So it's important to make sure that you read them carefully to see if there's any additional constraints or requirements that they have for you. Be very well versed in your contracts and make sure that they're appropriate for your practice. If you do need to make changes to your account, your PICOS account, etc., make sure that you do so within 90 days, as that's one of the requirements for becoming an enrolled provider. So if you don't see Medicare patients one way or another, do you have to do anything? We do highly recommend that you choose. So choosing to opt out or opt in is your two avenues here. If you let it lie as it is and you don't do either, and you never have a Medicare patient walk into your office, then fine. However, ultimately, at some point, somebody might have Medicare, or they might apply for Medicare, or their benefits might change. If you don't know that somebody that you're treating has Medicare and they ask for a private contract, you'd still be in a position of being out of compliance because an individual or a beneficiary of Medicare cannot be paying privately and also have Medicare if you have not opted out. So again, there's many different manuals and things that you can read about this, but in general, I recommend that you choose to either opt in or opt out. One thing that you should know is that you cannot opt in and opt out at the same time in one location or another. Once the MAC receives an opt-out form, since your NPI number is associated with that, you would therefore no longer be a Medicare provider if you were previously enrolled. If you do wind up having a Medicare covered client in your business and you have not yet opted in or opted out, know that you have 10 days to submit an opt out affidavit or 10 days to opt in. So we do recommend that you choose one or the other. And when in doubt, of course, you can look it up. As this is ever evolving as well, it's probably good to be on top of things. So here's some websites for you. The first is the CMS, Centers for Medicare and Medicaid Services website. The second is the Claims Processing Manual. The third is the Benefit Processing Manual. And then the bottom is a fact sheet on MPI and NPPES. And that is it. Hopefully that helps. And let us know if you have any questions. Make sure that you go to the guides and have a great rest of your day.